We have a video that's about a minute and a half. You will hear from our president and CEO, Phil Chrysler, and then you'll hear some of the details from Dr. Joyce Morgan Powell afterwards.
Hi, I'm Phil Chrysler, President and CEO of Impact Health Sharing. Healthcare sharing has brought freedom to many Americans who were looking for change, and we are happy to be part of this movement. Because healthcare sharing organizations are not insurance, we are not able to offer a guarantee that eligible medical bills will be paid. Does that make you nervous? Let's take a look at why this is and perhaps alleviate some of your concerns. Members join a healthcare sharing organization like Impact to be part of something bigger. They join and agree to share each other's eligible medical bills. So Impact itself doesn't do the sharing. We simply facilitate on our members' behalf through an industry-leading platform which provides transparency. My friends, something long overdue. Think of it this way. Healthcare sharing is a risk versus reward concept. People have been helping other people in communities since the dawn of time and will continue to do so. Before grocery delivery services came about, you just knocked on your neighbor's door for some sugar. But because of technology, we can now help one another in a more meaningful, better way. The reward typically is saving 30 to 50% on your healthcare. My friends, that's huge. These decentralized democratization business models continue to disrupt traditional thinking and industries. However, if this approach is just too risky for someone, then they can continue to rely on a for-profit insurance company that has been formed and is tasked to maximize shareholder value. That means they need to put the profits of that entity as a priority over its members. Let me ask you a question. If the so-called guaranteed approach was successful and is working, then why is medical debt the #1 reason for families filing for bankruptcy? There are over 100 million Americans in medical debt today, and that tells us something is broken. At Impact, we are all about solutions, and together, as a community committed to sharing, we can keep one another out of debt and put your money into something we believe in. Each other.
Absolutely, each other. So you'll hear from Dr. Joyce Morgan Powell. She actually owns her own home health agency. She's owned it for the past 25 years. She is a professional, but she doesn't explain to you some of the
Hi, I'm Phil Chrysler.
Impact Health Sharing.
Hi, good evening, everyone.
Good evening.
I just want to welcome everyone to this event. So glad you're here to spend time with us this evening. I'm Dr. Joyce Morgan Powell, as Lorraine said. I've been in the healthcare space for the past 40 years. I have been an independent owner of a home health agency for the past 25 years. And needless to say, the healthcare system is broken, okay? So I am very, very honored that I am a part of Impact Health Sharing. And so with Impact Health Sharing, you know, when you think about it, there's a lot of truth about healthcare, and 80% of the country is trying to lower their healthcare costs. How many of you had a big increase in your insurance this year? Major increase, right? So Impact Health Sharing is a disruptor in the sick care system. We're trying to make it affordable for everyone. So when it comes to Impact Health Sharing, you'll find that 50% or more of the healthier people are paying for those sicker ones, right? So that's the reason why the cost of healthcare has escalated as it is. So over 100 million Americans are in some form of healthcare debt at this time. So with Impact Health Sharing, there's massive opportunity to help people. And it's people from all walks of life. It's not about your religion or where you're from or anything like that. It's for everyone. And there is no across the board rate hike. In 5 years, they have not increased their prices. And that's wonderful. So members save 30 to 50% per month on average. It's very transparent. You can sign up for Impact Health Sharing at any time. There's no open enrollment. It's really every month, every first of the month, you can jump in on this plan. And there are exclusive wellness reward programs, and people, they consider people over profit. So therefore, they're not trying to make money off people. They're providing care that people really need over cost. Okay, with Impact Health Sharing, they have these Live Well rewards. And with those, you can have a massage, you can go to the chiropractor, the acupuncture, you can have gym membership with this plan. So what it is that you get $150 back. So each month, and it's by the household, right? You can have up to $150 spending that you can use toward your PRA, which is equivalent to your deductible. So it's like you're paying it forward, okay? And Mr. Farrell, can you please share with the audience your experience with using Impact Health Sharing benefits when you went to see that doctor?
Yes, I was able to use, I've had it now for 3 years, and I only use it for my annual physicals and stuff. But this year I did my annual physical and I got a colonoscopy. I went there, I showed them a card. They made a couple phone calls. They said, yes, we'll take this company private insurance. We will do it. Everything was good to go.
Awesome. And Mr. Elliott, you also had an experience with a family, I think it's a plumber, and with that family, how were you able to help them lower their healthcare costs?
Well, it was a couple. They was actually paying, he's a business owner, he owns a plumbing company. And he invited us to his business, and we gave a quote. Now, this guy, for him and his wife, they were paying $4,000 a month for two. And he said that every couple of months, he would get a call. The insurance company wanted to know how much he was making that quote. Now, Impact, number one, it's not based on income. It's based on the oldest person in the household. We gave him a quote, he ended up with a quote of less than $700 a month for two. And that's the kind of impact we talk about. That's why I love Impact. We are literally helping people save money. It's not right, excuse me, they don't like for me to say that, but it's just, you know, the facts out there. The facts out there. Thank you.
Thank you, Mr. Elliott. Okay, so who is interested in knowing what their coverage would be if they should use Impact? Remember, it's by your age. It's by age and not, it's nothing to do with your zip code or your income. It's by age. So in a household, you have a family of 3 or you have 10, you're going to be paying the same coverage. And that PRA or the deductible is going to be for the entire household. It's not going to be per person. Okay, so I am going to have
Joyce, if they want to take a screenshot of it, please take a screenshot and you can take a look at it later.
If you can't see it, I'll just read it to you. So for instance, the PRA, which is the deductible, it's like $2,500, it's $5,000, $7,500, or $10,000. So if you're in the age group category 18 to 25, if you decide to do a $2,500 deductible, then your cost per month is going to be $550. If you're in age range of 26 to 37, it's $576, 38 to 46, $605, 47 to 54, $628. If you're 55 to 64, $674 to $812. Now, if you're a senior, that is if you're over 65, your coverage is going to be anywhere from $96 per month, $119 per month, or $142. But here's the deal. It does not matter. There is no pre-existing. So if it's cancer, if it's diabetes, whatever the problem is, you can sign into Impact Health Sharing and you have nothing to worry about because, like I said, there is no pre-existing, okay? And the only difference is that you cannot combine another person with that senior. Say if there's a wife and a husband, they both would have to have their home coverage. And now, we have something called reference-based pricing. So for instance, you're going to see the doctor, or you're at the hospital somewhere. Now, if that hospital bill you, or the doctor's office, wherever they bill you from, if they bill you, here's an example, $200,000 was billed to Impact Health Sharing. What do you think about that? And it happens every day, trust me. So now, what Impact Health Sharing does, they do an reference-based pricing automatically. Because remember, they bill to Impact Health Sharing. And they're like, oh, no. There is no way. We're not going to pay that. So what they do, they right away, they negotiate. And from that $200,000 bill, it's now $179,840. They do a further reduction because there's a sharing, so it goes into that sharing pot then, right? And what they do, they deduct another $20,000, and then there is a $13,655 that is shared. It leaves you with a cost of only $6,517. So your bill initially was $200,000. Now you're paying only $6,517. Now that's an impact, isn't it?
Yeah.
Impact Health Sharing. Yes. Now, with Impact Health Sharing, you also have vision plan and dental. It's all inclusive. And the vision plan is with VSP, and the dental plan is with Carrington. So, again, there's always reference-based pricing. It's very transparent, but nothing is hidden. You know the cost of anything before you go to see those guys. It's not like traditional insurance. You go there and then you're surprised with the bill afterwards, right? They bring up something and you're like about to faint because they didn't tell you about it beforehand. With Impact Health Sharing, you are going to know the price of anything before you get there. So now there's a community. It's called the Health Share Crusade Community. And you can always join this community. But before we go any further, I'd like to invite Mr. Rodney. Rodney's going to share with you how Impact Health Sharing has impacted his life. Thank you.
Thank you, Ms. Grace. So, wow, how much time do we have? 5 minutes, okay. I'm gonna run through this real quick. Let me give you a little bit of background about me. I grew up on a farm, right, away from Texas. And by the time that I was 18 and out of high school, I launched a career in the meat industry. So I was in my office one day, and this lady walks into my office. She asked me what I did for a living, and I was like, I told her, and she said, "You'd be good at what I do." Now, that being said, it took her 6 months to get me to look at this information, because I was bullheaded, and it's not that I wasn't gonna look, it's just that I wouldn't make time to see a small piece of information. Now, this is 19 years ago. So I've been doing this for several years. When I started, the service that ACN was offering in my area was just electricity. Because in Texas, you can choose your energy company and save money. Fast forward, this company has added multiple services to their portfolio. Impact is another service. And it's the most ideal business opportunity for any individual in America today, in my opinion, because you're doing two things. You're helping other people save something that they on money on something they need in a time when it's definitely needed, right? And you can also add an income to yourself by helping somebody else save money. Does that make sense? I mean, in America today, everyone that we know are trying to accomplish two things: save money and make money. And that's what we offer. Obviously, there's more to it and more of the details, but when you have a service like this, and a lot of the other services that we offer to individuals as well, it makes this kind of business opportunity amazing for anyone. So that's my story. As far as impact goes, real quick, I fell on a curb last October. Off a curb, the shoulder stayed up on the curb. The rest of my body was in the street. I went to UMC in Lubbock, and they did x-rays, told me that they couldn't find anything. It was a $500 bill. They negotiated it down to $135 impacted, right? Fast forward to March of this year, last year, and I had to go get an MRI. The MRI was $1,300. They negotiated that down to $400. So those two costs went towards my PRA that Dr. Joyce explained to you. So when my renewal came up, I lowered my PRA, and I also have a massage therapy, and I do some light wave therapy, and I take those invoices and receipts and I upload them to my member center, and it's lowering my PRA because I'm using that service anyway. I'm going to be paying for it anyways, right? So by the time that I have this rotator cuff surgery, I might be out $100 total cost. So if anyone has insurance and you don't have that story, ask yourself why. Because your insurance company don't want you to be healthy. They want you to be sick. Impact wants you to be healthy. And they want to keep your money in your pocket. Thank you. That's all I've got.
All right, before we wrap up, we're gonna, Saturday morning, we have a deep dive into impact. If you're interested in knowing more about impact, we're going to be at the Salem Center off of Bentley Road, Saturday at 10 a.m. sharp. So come on out. If you need the information, please see me before you leave. I'll get you the information.
And remember, Impact Health Sharing is a comprehensive plan, and it's better than any insurance that you can have. Thank you.
That's right.
Did anybody have any questions for Impact?
Do you have any cards or brochures that you can share?
Any other questions for ACN with Impact Action? Any other questions? Going once, going twice. So.
Thank you, guys.